Okay, guys, I'm back with medications on for seizures, migraines, and for mood stabilizers. We're going to talk about today those medications which have a tendency to be weight gainers, some alternatives to those medications, just some thoughts around that. So, medications for migraines would be common things we use, things like nortriptyline, amitriptyline. Use those all the time for migraine prevention. Things that are mood stabilizers, you're looking at things like valproic acid or Depakote. Gabapentin is huge. We use gabapentin all the time for chronic pain, for restless legs, gabapentin is used a lot. So the bigger the dose of gabapentin, especially, the more weight gain. Gabapentin is a big weight gainer. Sometimes people need that just to get through the day. We're having quite a bit of pain. Sometimes there's other ways around that. Definitely worth talking about though. Carbamazepine, valproic acid, Lyrica. Lyrica is related to gabapentin. So Lyrica is pregabalin. Gabapentin sound a little bit alike. Both Lyrica and gabapentin are they're huge weight gainers. And in my experience, I find that I often will see people who have chronic back pain or they've got chronic nerve pain, and they're coming to me and they're concerned about their weight because now their back and knees are hurting more because they have a lot of pounds to lose. And in a lot of those people, I've said, hey, what if we kind of backed off a little bit on the gabapentin? We back off, or we back off on the Lyrica, we back off on those medications, and they come back in a few months and they're like, the pain still sucks, but it's not any worse than it was, So it's like, sometimes you have to ask yourself, how much is this medicine really helping me? Is it helping me more than it's maybe hurting me in terms of my weight management? Those medicines are anti-seizure medicines, gabapentin and Lyrica, so they should not be stopped cold turkey because seizures can happen if you stop seizure medicines cold turkey, so don't do that. So for those suffering from migraines, those folks who are on amitriptyline maybe, and I think, low dose amitriptyline, 10, 25 milligrams, I've not seen a ton of weight gain from that, but definitely medicines like Topamax, which is a seizure medication, can be very helpful in terms of prevention of migraine. Verapamil, propranolol, both blood pressure medicines. Those are blood pressure medicines. Those are also useful for prevention of migraine. So I would say that, hey, if you've got migraines and you're on amitriptyline, you might talk to your doctor about saying, hey, could we consider using Topamax, also called topiramate. They all have two names, like I said before. I don't make this up, just how it is. Those with seizure disorders could talk to their neurologists or doctors about Zonegran, Lamictal, Keppra, Phentoin. Keppra would be like one of the most common seizure medications that's available today. So, maybe a person is on an old school seizure medication with weight gain as a side effect, and they could be switched over to Keppra and have kind of less side effects that way. So just, again, worthy of discussion with your physician. I talked a little bit about mood stabilizers for depression, bipolar. People will take medicines to sort of level them out. I talked about that in the mental health medication lecture. Seroquel, for instance, Risperdal. There's a number of different kind of Abilify, a number of these mood stabilizer medications that they particularly the Seroquel, that do cause some weight gain. And it's like, well, would there be something that might be a little more weight neutral or even help with weight? And again, I've talked a lot about ketamine during that lecture on mental health medications that cause weight gain. I still think that's a good piece of advice or a good potential solution for those with a desire to look out kind of off the beaten path. So the next lecture, we're going to talk about heart health medications, blood pressure medications, heart health medications that can be associated with weight gain and kind of some alternatives to those things. Thanks.